Hi everyone, my name is Siew Kam Chuan. Today I'm going to present about the online mental health promotion program. This program is related to the Proceed model, which is a comprehensive structure of assessing the health needs for designing, implementing and evaluating health promotion and others public health programs to meet the needs. There are 9 phases in Proceed model, and the first phase is social diagnosis. Social diagnosis is need to ask about the community what is the wants and what is the needs to improve the quality of life among the community. The second phase is epidemiological diagnosis, which need to identify the health and other issues that that need a clearly influence that outcome from the community seeks. And the third phase is behavioral and environment diagnosis. This phase is need to identify the behavior, lifestyle, and environmental factors that might be changed to affect the healthy issues. And the fourth phase is educational and organizational diagnosis. This phase is to need to identify the pre-proceeding, enabling, and reinforcing the factors act as a support to the barriers to changing the behavior and environmental factors. Furthermore, for the fifth phase is about administrative and policy diagnosis. This phase is need to identify and adjust the internal administrative issues and the internal and external policy issues that affect the successful of the intervention. Next, the phase of number 6 is implementation. This phase is need to carry out the intervention. And the phase number 7 is process evaluation. After carry out the intervention, we can evaluate the process of the intervention. And phase number 8 is impact evaluation. This phase is to intervention that have any impacts to behavioral or any environment factors. And the last phase is outcome evaluation. This phase is to evaluate whether the intervention's effects are in turn producing the outcome and can be adjusting accordingly from the intervention. Alright, based on my observation, I think that there are 8 phases that included in the online mental health promotion program. The first phase that involved is phase number 1, social diagnosis, phase number 2, epidemiological diagnosis, phase number 3, behavioral and environment diagnosis, phase number 4, educational and organization diagnosis, phase number 6, implementation, phase number 7, process evaluation, phase number 8, impact evaluation, and the last phase that involved is outcome evaluation. From the online promotion program, I have learned about the factors of a person that have a mental health problem. And the factors who causes a person have a mental health problem is maybe it's genetic problem, social environmental issues, use of alcohol and drugs, and also have a childhood history of being abused or being neglected. And too stressful also a factor that may cause a person to have a mental health problem. And the characteristic of having the mental health problem is a person with feelings sad or down and confused in thinking, they have a down concentration in their work or study, and a major of them have a major changing in their eating habits, and they have a extreme moods changing in high and low. And in the important is maybe they have a suicidal thinking in their life. From the program, I also have learned several ways to overcome the mental health problem. The first way is we can get help from our family members and friends. We can talk to them, communicate with them, and we can take good care of ourselves, like eating a good habit, eat well, sleep well, and rest well. And next is we can learn how to deal with the stress, like we can do exercise and take a deep break or meditation to relax our stress. And also we can avoid from taking alcohol and drugs, and also we can get a medical care, and like for example, like we can get advice from doctor and also counselors. Last but not least, we can have a volunteer. We can volunteer ourselves to do it to help other people. This because we might feel good after doing something tangible in helping people, so we can change our mindset from being a stress or mental health problem. Okay, my recommendation for future healthy online program is we can start a YouTube channel which allow us to promote or post some educational content about mental health problems, such as some tutorial videos or presentation videos that help us to reach to a bigger audience. Next, we can promote our events or program via social media. For example, we can promote on Facebook, Instagram, Twitter, so we can attract more audience and many people will gain benefits in this program. Last but not least, I think we can facilitate student success and foster a sense of a virtual community through student to student communication. This can improving the student engagement and which can reducing the feeling of isolation in online program and provide more opportunity for students to interact with each other. That's all from me. Thank you. See you next time. Bye.